Welcome to the Aesthetics Unfiltered Podcast. We are Michelle Jones and Melanie Torres, two leading medical aesthetic nurse practitioners and great friends based in California. We uncover the inner workings of the booming aesthetics industry from both the patients as well as the providers' perspectives.
Join us for the authentic conversations about current and trending treatments, best practices, and the real issues people face with modern beauty standards. Any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
All right, you guys, welcome back. We are on part 2 of skincare must-haves. And we have Holly again, who is an amazing esthetician at our Skin Spirit Burlingame location. And how long have you been doing esthetician or skincare services?
2018. So,
and she is one of our busiest providers. Patients love her, and their skin is glowing when they walk out of the room, and they love her treatment plan. And I see a big transformation as well. So we work closely together, with me doing all the medical injectables and lasers, and Holly does all of the medical grade skincare and facials. So our first take on this, which is the episode before this, we talked about the must-have medical grade skincare products, which include vitamin C, retinoids or retinols or tretinoin, and also exosome / growth factors. And medical grade skincare is basically skincare that has clinical trials that support that they work, because a lot of skincare out there does not. And even if it has a doctor's name on it, or if people are claiming things, you can claim anything. So be careful out there and stick with like medical grade stuff, and make your routine, like find products that work for you that are simple and not a ton of them, and make your routine simple but powerful.
Yeah. I also think, side note on this,
sorry, that was
the
intense.
Doctor's name ones, like
maybe
those,
they're good.
no,
maybe
they're
good.
not. I used to work at a plastic surgeon's office. They use all the same products. It's a parent company, and they all just put their private label on it, and those products are
not great.
Trash. So stick to like the Skin Betters, the Skin Medicas, Skin Suticals, the ones that have the big name brands that like tried and true.
Yeah. And those should be found at like a dermatology office, a legit medical spa, a plastic surgeon. I don't know. It is confusing out there, because now that I'm talking, I'm like, okay, they probably could have lots of different skincare lines. But basically, if you can do some research and show that like there's clinical trials on them, it's usually a pretty good product, in my opinion. So now we're going to go into some accessory products that are still medical grade and very good. And what do you want to talk about, Holly? I know hyaluronic acid. People always ask about that.
Yeah.
Glycolic acid, scrubs, exfoliators.
Totally. I think I'd rather kind of break into different skin concerns and how we can help treat those
better.
So when you have your client who is using, like we said before, your vitamin C, your retinoids, your sunscreens, your growth factors, but they're like, hey, Michelle, I'm still crepey. How are you going to treat them? You're going to do your
we need a lot of injections,
your sculpture, all of that. But how can we topically help that?
Yeah.
Dehydrated, dry skin needs a hyaluronic acid serum. Why? Hyaluronic acid draws moisture in the skin. It helps plump up that crepiness. And so it's a good addition when we're already using all those other products.
Well, how does that different than a moisturizer? Do you need both? I get confused with that personally.
Totally. And I think, one, it's based on people's budgets, right? Because I think when you're buying over-the-counter hyaluronic acid, a lot of the time it's not formulated to be anti-inflammatory. So it can actually cause more issues when you're buying your $10 hyaluronic acid. They exist, but should you be putting it on your face? No. It's not going to give you the results you want. With these medical grade, they're typically 5 molecular weights. So it's really penetrating into the skin, and that fifth one helps reduce the inflammation in the skin. And so hyaluronic acid holds up to 1,000 times its weight in water. Helps plump up your skin. When you put a moisturizer on top of it, it's actually allowing those like hydrators in the moisturizer to penetrate the HA molecule. So it's helping give your moisturizer a better boost.
Oh, I like that.
Does that make sense?
That does make more sense.
Yeah. So
you're doubling up, basically.
Totally. And it's helping just give you that extra layer of hydration, which is different than oils. water and oil don't mix,
Right.
right?
Mm-hmm.
And so hyaluronic acid is really just giving your skin more water, more hydration.
Wow.
So if you're fine, crepey, feeling crusty, all those things, an HA serum is going to be a great addition to your routine.
Yeah, I just started the Skin Medica HA, and I
Me
usually don't see like a huge. I mean,
Mhm.
I love the HAs. I use everything, and I'm doing the opposite of what I'm telling you guys because I do like every skincare product. But what I can't help it, but I do want to simplify. But that one I'm feeling a difference with actually. Like
Yeah.
I feel like I don't need a moisturizer with that one. It's feeling
You
really
still
good.
need to put a
I
moisturizer
do?
on though.
Okay, all right.
Hyaluronic acid is a humectant.
Okay.
So humectants draw moisture into the skin.
Okay.
They're drawing into itself. It's trying to like create equilibrium and create more hydration into that molecule.
Okay.
However,
Yeah.
you live in Arizona and you put on a hyaluronic acid.
Yeah.
It's actually drawing moisture out of your skin. That molecule is drawing out because it's drier in the outside world. So if you're not locking
So
it
your
in,
environment really matters.
very much so.
Okay.
If you lived in Hawaii and you were super oily,
Yeah.
you could totally just use a hyaluronic
Okay.
acid, no moisturizer. But we don't live in Hawaii. It's not
Okay.
that humid here. So
Yeah.
you need to lock in your moisturizer. Or lock in your
Okay.
PJ.
So environment does matter, you guys. Like that's so interesting. And that's why we switch up our routine. Are you having an allergic reaction to my cats?
Maybe.
Holly is allergic to cats, but is so dedicated to this podcast that she has 2 Claritin in her body and a Benadryl to be here. So,
It's true.
and another good thing is, don't hang out with cats if you want good skincare if you're allergic to cats. Like,
I mean,
that's
it's getting my
basics.
sweat on. It's
I
getting
know.
my sweat on. I'm getting sneezy, so we're getting real juicy looking.
All right. So moving on to that was hyaluronic acid. How do you know what kind of combination skin you have? Like everyone, like how do I know that? Or is that a bad question? Does that not matter?
No, it definitely matters. It
Okay.
100% matters. However, I don't think that the average person can analyze their own skin.
I agree.
And the reason being is when you're using an improper cleanser or you're using the improper products for your skin, you can sensitize your skin to a point that it's not really how your skin would behave.
Oh.
It's how you're treating your skin and how your skin's responding to that treatment, right?
That's deep.
And so I think really you need to come in to see a professional to get that analysis. And before any treatment, I'm feeling their skin. I'm asking them questions about their skin. I really want to see how their skin's behaving with the products that they're
makes
using.
sense. Yeah.
Because if you are, for example, if you improperly take care of your skin, your teen clients, even well into their 20s, 30s, if you're using too drying of products and you're not hydrating enough and using the right products, you're causing these little tiny blackheads all throughout your skin. It's dehydrated.
Okay.
And so I think we really need to start. People would be like, oh, I'm so dry. I need more salicylic. I need to dry up this acne.
Yeah.
And actually, you need to hydrate your skin. We have to start by hydration. And so with those clients, we're not even talking about acne products yet.
Okay.
I'm not getting into that. We are just talking about how to hydrate your skin. And
I
so
love that.
I think it's really tailored to their specific needs as opposed to being like, this is a one size fit all, because you can't.
So really you need to see like a medical professional to best take care of your skin.
Yes.
That's what we're really getting at the point.
90% of my clients are like, yo, I have dry skin.
Yeah.
Or I'm so oily. And I'm like, ma'am, you have no oil glands. Like there is no oil being produced and you're just drying yourself out so much that I don't think the average person can be like, I'm oily skin type, because they don't know.
Yeah.
You know?
I love that.
Yeah.
So we covered hyaluronic acid. We covered skin type, like
See a professional.
And then what do you think, like the other things that we hear a lot of is, do we need to exfoliate? If so, what type of exfoliants? Because we have chemical and we have scrubs.
And enzyme.
Yeah. Okay, let's talk about that.
Yeah, we got to figure out what kind of skin type you are, because not every exfoliant is appropriate for everyone. Inflamed acne is not a scrub exfoliant.
Right.
Inflamed acne with a scrub is going to spread bacteria and cause more inflammation.
That's
and
what I did
irritation.
when I did the tretinoin plus the morpheusate plus.
Oh, yeah.
I started scrubbing my
we've
face
all
the
been
next
there.
day because I'm an idiot. And
And how did that treat your face?
It was bad. It was bad. And I think you helped me. You told me what to do. So thank you.
Hydration.
Thank you.
It's really about learning what our skin type is, right? Drier skin types, the average skin can totally use a scrub. Scrubs are going to physically remove that top layer of skin. Yeah. It's going to help create more radiance. It's going to allow for better product penetration. But again, scrubs aren't for everyone. I think for more acne prone skin, acids tend to do a really good job.
Yeah.
So salicylic in particular, salicylic is particularly formulated for more acneic skin. It's a BHA. Mm-hmm. It breaks up the oils that are deep in our skin. So it helps on a molecular level start breaking those up. Okay. Breaking up that congestion. So acids are great for acne. Scrubs are great for everyone. For your sensitized clients, an enzyme exfoliant is really going to be the best.
One. Yeah, it's very gentle.
Like Skinzyme, Jan Marini Skinzyme, everyone should have in their arsenal.
I have that.
Everyone should have it.
Yeah.
Enzymes gently eat away at the dead skin so it can create a nice glow, still get rid of that dead skin layer, but without the irritation. So
yeah. Very cool.
Yeah.
Okay. Now, lastly, let's cover eye products. Do we need an under eye serum? Do we need a neck serum? Can we use the products we're already using in those areas?
So,
what are your thoughts?
Yeah. What are your
my thoughts?
Professional opinions first? I would love to hear.
I mean, I think the eye and the neck area is different tissue. And so there are products that are formulated specifically for those areas.
Totally.
And that's why they exist.
Yep.
And I think it is harder to see results in those areas because they age faster because they're different than the tissue on our cheeks. I do use those products. I think I also put like hyaluronic acid under my eyes, things that are hydrating and moisturizing. A retinol under the eyes hasn't done well for me. I usually just get like really bad, like redness and crustiness all over my eyes and they look way worse. I have like an eczema response. So I think that, it might be slower to act in those areas because we're all looking for a change so quickly there. But those are the areas that are aging the fastest. But that's why there's formulated products specifically for those areas.
Totally. I agree with that. I think if you're on a budget and that isn't one of your primary areas of concern, I think bringing your products up to that area is totally fine.
Yep.
Like you said, though, that tissue is thinner. It's going to age quicker than the rest of your skin. So if that is an area of concern or genetically, like you notice that your family gets saggy baggies, all those kind of things, I think taking better care of those areas. But again, budget friendly, like not the most necessary.
Yeah.
But definitely want to bring your products down. Your vitamin C, everything should be going down to your neck and chest.
Yeah. Yeah. I definitely do everything on my face. I like spread it down to my neck and my hands.
Yeah.
So I think that's the best way. Make sure that you're doing that because you're already paying for those products. So maximize them.
Totally.
And I think that's a wrap. So if you guys need a skincare consult, come see Holly. She is at our Skin Spirit Burlingame clinic. We are in the San Francisco Bay Area. I am also there, and I am your master injector. I hate that term, but I'm going to throw it out there for you.
And together, you'll look as great as we do.
We'll have some fun. We'll definitely laugh. I don't like things that are super uptight and snooty because the world's too hard. And it's like, we're already stressed out going into about our faces. So let's just keep it light and try to do the best we can and have fun along the way.
Totally.
And we're here for you. So come visit us. And if you like this podcast, please share it. Please like, please follow. And if you want more Skincare 101, I will invite Holly back. Or if you just like her in general, we'll bring her back and talk about random things. But she's amazing and really experienced in the skincare space because I think of your skincare routine as actually a medical treatment. I treat mine like a medical treatment because I actually think doing a really good skincare routine will do more for you than one laser a year. Yep. So those are my thoughts. And thanks for listening. And the next episode will be on the top 5 LED masks and my thoughts. Okay, stay tuned. Bye. For our latest news, follow us on Instagram at aesthetics.unfiltered.podcast or in our personal pages on Instagram.
Mine is melanie.skin.np and Michelle skin.smarty.np, both on Instagram. Have a great day.